Greetings. This is Surviving and Winning. I wanted to come on to express the need for us to vote. I know some people will say it's not important, it's not going to matter, it's not going to do anything. It's not. There are people that are fighting for our ability to vote. Our ancestors were fighting for our ability to vote. Our government programs that we rely on heavily are those that it's called a budget. So if nobody wants it to be in the budget, you won't have anything. I'm trying to I'm at a point in my life and because everyone knows on Surviving and Winning that part of the problem is that um healthcare people are getting cancer. And I know that if you don't have cancer, you may not be able to relate to me. And you may have figured out how I got it and why you don't have it, or you don't think you'll ever get it, or I don't know. I never thought I'd be in this position. And I don't know if it was arrogance that put me into the position or of having cancer, or if it was the fact that I didn't understand. And most of the people who can tell you about cancer and really give you the rundown of what it's like um, are dead. Um, and the other ones don't have time because they're fighting cancer. A lot of times, what I found, and I'm just trying to grow in this, because to be honest, I was really one of those people who didn't think I would get it. One, because I exercise a lot. The other was because I ate all the foods I had. I studied nutrition. I studied vitamins. I did all these things and I followed them. And there were things I wanted to eat. But as I start to gradually go into a really, really healthy diet and exercise, I found myself with cancer. And I feel like that a lot of times when we're comfortable, we one up each other. It's like, oh, okay, she got cancer. Uh, I'll never get it because I'm better. Or she got cancer. She didn't go. She wasn't of the right religion, or she wasn't doing what I do, or she let herself be stressed out, or like they have a lot of reasons they'll never get cancer. And what I found is I was in a cancer cluster. I was actually in a cancer cluster community 30 minutes away from where I was living. Now, I started to feel bad before that, but for the type of cancer that I had, is not some environmental. But do not believe that just because you are not living near a nuclear power plant, you're not going to get cancer. Don't believe that. So we got this coronavirus. We got the flu. We've got a lot of things going on that can kill you. We got HIV. There's a bunch of diseases. And so what I'm imploring to you is that whether you need Medicare, Medicaid, any kind of anytime health insurance, you want to go to the emergency room, every single thing that could happen to somebody else can happen to you, and it will be life or death. Do not work. That's worse You could be inside your home safe and sound. You can be a person who has limited means, middle class, or rich. If your health care is not in order, you will die. And it is the equalizer. I'm not asking people to be afraid of death. But what I am saying is that you can die. And that people who are dying are not less than you. And that you are not a person that is ever, no one in the history of man, not even Jesus, has escaped death. So when you are listening to these healthcare plans and they do not include you, that's you. You don't have to be in the military with a rifle on your shoulder after you have gone through boot camp and have been dropped in the middle of a war-torn country to defend the United States. You do not have to be that to be on the battlefield for death. Cancer is a battle. Before I got cancer, I didn't have cancer. And I was one of you. We still the same. And most other people that have cancer right now who are not getting themselves checked and are not going to their appointments and not are afraid to hear the results have it already. The only thing that's going to make you die from cancer is not to be able to get checked out and get that checked early. So while they're fighting over whether you can have health care or not, they're basically saying whether your life matters or not. This is important. I don't care who tells you not to vote this time. You're going to vote. And I don't care how many times they act like, well, this election, it's so hard to tally the votes and the apps are falling down and nobody knows what the hell's going on. And I know I'm not monetized. I don't care. I am going to cuss. I haven't cussed in what like 20 years. I have not been an advocate person to curse. I'm gonna tell you one thing. Nothing is worse than someone allowing you to die. I promise you that. I won't have a whole lot of people. Maybe nobody will listen to the broadcast. Maybe I'll put myself out there. But one thing it will be, it's out there. You're gonna have to understand that if you don't have insurance, you will die. If they take away pre-existing medical conditions, I'll be honest with you. My cancer would not have gotten as bad as it did if I didn't suspect it and felt like I better not go to the doctor because I don't have insurance. And if I get caught in an emergency room with a pre-existing condition without insurance, that I'll never be insured and I will die. It is better for me to ignore this until I get a good job that provides insurance. That is the truth. But you know what else is the truth? Is that I let that lump grow and I got metastatic cancer because I could not. First of all, it's not that I'm not educated. This is not about being rich or poor, but it's not about poor or rich or educated or uneducated or middle class. I don't even know if there's such thing as middle class. To me, how can it be that you get all this education? You're gonna be poor because your education, your student loans are gonna be like slavery because the only people gonna get any advantage out of your education is your employer. You're not gonna make that kind of money. you're going to make the same amount of money as someone who did not have an education. And the people who did not finish high school, or the people who did finish high school, they're just going to be automatically poor. Understand that when these Democrats, Republicans, or whatever are not talking to you, if they're not talking to the poor, and don't let anybody ever tell you that the poor people in the United States of America are just living off the system. They cut that out a long time ago. What you want is those things that are there that benefit you if you lose your job. So, and when you lose your job, you will be among the poor. So do not look down on the poor, and do not allow them to take away the benefits that the poor are going to receive. Because that has nothing to do with you. They will not lower your taxes because they are no longer giving that money to the poor. What they will do is distribute that money elsewhere, or they will lower the taxes of the rich. Your taxes will stay the same. So you may as well allow those taxes to stay in whatever assistance. I don't care if it's food stamps, Medicaid, Medicare, or whatever. Do not feel like or get jealous of somebody who's not working because the boss that you're working for is giving you a hard time today and you wish you could have stayed home. Do not be jealous of the poor, because that doesn't exist. Most of the people cannot they can't stay in government housing anymore. In the place that I'm living, they can't. Well, I don't live there anymore, but the place that I used to stay, that city, not where I live, but that city, if you were poor, they've taken those people out of the public housing because it was not, it didn't meet standards for living. They're in hotels right now. Don't get jealous of that. People have died in their buildings because of substandard living. So don't get jealous of that. Just make sure that is available for you in case you get sick, because I promise you, cancer is the equalizer. I don't care how much money you have. And you're going to see a lot of rich people get cancer, middle class people get cancer, poor people get cancer. Why don't we just stop trying to decide who's going to live or die? Why don't we start there? That would be great. Stop worrying about who lives and who dies, and deciding whose life is valued based on a piece of paper, green and light green and dark green, because a lot of the people who have money have never worked a day in their life. So let's stop valuing money and start valuing people. And it may sound like I'm angry. I am angry because you're not there are people who have cancer and don't know it. There are people who are dying of cancer that you don't even have time to visit. There are people who are caregivers who quit their jobs to take care of people with cancer. There are people who can't afford chemotherapy. There are people who can't afford radiation. There are people who can't afford, even if, and this is getting cut. What I want everybody to really pay attention to what's going on right now. If you have YouTube, then you can go and you can watch what's going on right now. Please stop listening to me. Nobody's on my live stream right now. Stop listening to me and listen to what Nancy Pelosi had to say in regards to what's been done behind the scenes. No, I didn't watch the address, but what was happening behind the scenes is that she stopped them from the House stopped them from banning pre-existing conditions, and as far as healthcare was concerned, and if you have cancer already, that's going to be a problem. And as I addressed earlier, then you don't even want to go and get your pre-existing condition checked if you have cancer, because if you don't have insurance, you do not want that pre-existing condition because you won't get insurance. If I can run down the numbers to you really quick. If you have to go, I don't know what chemo does. I like how much that costs. But if you have to get radiation, it can run you as much as, just for all of those people outside of the cancer community, it can run you about $3,000, $4,000 each time. For my radiation, it ran about, I think it was like between 3,000 and 3,500. I had to have 30 of them though. Do you have that kind of money stashed away? If you don't have insurance, you have that kind of money. If nobody will give you insurance, no. So if you are one mammogram away, if it's breast cancer, you're one mammogram away from losing your home, your car, every asset that you ever had. Some people don't have these assets, so they're not worried about it. Trump is trying to take away all. You won't have access. So that program will be gone. You just die. So you understand, this is life and death. I don't know what TV show people are watching, is Love and Hip Hop, or, and I have nothing against that, but you don't have that kind of money. They don't have that kind of money. Or else they wouldn't be on reality shows telling their personal business. It costs, like, for me to tell my personal business for free is a lot for me to do. But you don't have that kind of time, or you really, really, really need to vote to hold on to what you have and ask for more. A cancer patient should not have to get up out of bed to save their life, their own life. And I can be brave enough to say this because I probably don't have a whole lot of time. So they came to kill me now because I made this message, because that is kind of how everybody feels. They feel like if they say anything that goes against the current administration, they're going to be sought after and killed. I don't have anything left. I may die. But I've already had several years to deal with the fact that I might die. Prior to even a cancer diagnosis, I just kept getting sicker and sicker because I was worried about the fact that I think I might have cancer. And I have a pre-existing condition with no insurance. And I did. And I ate the right foods. But I was hand tied. But I didn't always have cancer. It doesn't mean that you'll never get it. So don't let someone take that safety net away from you because you think that you will never get it, because you think you're better than everybody that has it, or we did something to get it, or we did something wrong. There's a cancer cluster. And they studied that. There's certain areas. They're opening up a new cancer hospital because they can't supply the needs of the current cancer patients, and there are more coming. They know there are more coming. This is not a time to sit back and play and watch reality shows and play on the internet. And I hate that I might be bringing people down, but maybe if I can't save my own life, I can save yours. This is surviving and winning. Peace and blessings.